Hello, I am Chelsea King, and I am the Executive Director of the Oregon Health and Education Collaborative, and we are a statewide nonprofit that is asking partners in health and education to come together in a community-based and culturally responsive way to answer the question, if anything were possible, what would it take to ensure that every child, family, and community has an equitable opportunity to succeed? And I'm so thrilled to be here today with Dr. David Willis. And I'll just introduce you and then ask you a question, and we can get started with that. So Dr. David Willis serves as a senior fellow at the Center for the Study of Social Policy, and he is a national expert in pediatrics, early childhood systems, and early relational health. He leads the Nurture Connection social movement to advance early relational health at the growing intersection of child health transformation and resilient community building in partnership with families and with a social justice commitment. I loved that sentence so much, and I love the work you're doing, and I'm really thankful to be here with you. So I'd like to start because this is your area of expertise, and it's something, I think a lot of folks are still learning about. Can you tell us what is early relational health?
Oh, thanks, Chelsea. It's great to be here, and I'm so excited about the Upstream initiative and imagining what's possible. And early relational health is about capturing that which is possible when we create strong, supportive relationships around pregnant mamas, new families, and the youngest experiences. By definition, early relational health focuses on the importance of early relationships and experiences that promote healthy development across a child's lifetime. But it particularly calls out that earliest period of connection for the well-being of both the caregivers as well as for the children. So shall we start there?
Yeah, very, very important. And so thank you for mentioning the Upstream initiative. As we're really focused on creating a model of care so that all children and families can thrive in that first 1,000 days. And I'm just wondering if you could connect early relational health to the first 1,000 days and just tell me more about why that time period is so important.
It's really important. Early relational health is really foundational for a child, the development of well-being of both the caregiver and the child themselves. And we know out of all of our studies that children grow up in the context of safe, stable, and nurturing relationships, that the building of education readiness, the foundation of health and well-being, and social emotional well-being, preventive mental health, all happens as a result of the experiences, especially the earliest experiences. Like John Kitzhaber would talk about in the Blue Sky design efforts, imagining what's possible is that every pregnancy, young family, and children are supported by those safe, stable, and nurturing, encouraging, promoting positive relational experiences, because that's what we've known generationally is what allows for future well-being. And as the Surgeon General just talked about last week, we have a crisis of isolation, a crisis of disconnection, a crisis of the failed connection. People are lonely. It's shocking. And loneliness is not good for the development of young children. And loneliness is countered by authentic, positive relationships with others. Certainly, babies know that. They need it. They seek it. And they smile at you to show it. You know it. But that builds their brains. It helps create that buffering. When little babies get stressed, they need somebody to be there to connect with them, to help them feel safe again, to reemerge into that smile. The physiology of that little stress response, mitigated by positive experiences, decreases cortisols, creates calming states in the physiology of the body, creates the very foundation for building the stress regulation system, building the physiology of health, and build the attention systems. It all has to do with safe, secure, and positive relationships. That happens. We could talk about those first 1,000 days, but that's prenatally to basically age 2. But in fact, it's probably that prenatal period to age 6 months. It's astounding the criticalness of safe experiences around young families, pregnant mothers that are supported by a safe caregiver, be that their spouse, be that their mother, be that their neighbor, or their doula, or their midwife, or their a trusted health provider. That sense of being embedded in a community that creates a little cocoon of loving, joyful hopefulness, protection, and safety is that relational health envelopment that begins to create the relational health promotion effort as that dear mama who's pregnant is imagining the baby that she hopes to have and the joy she hopes to promote in their development. And then for all families want to do it well for them, for their next generation, and for themselves. That kind of support is required also after that young baby is born into a new family that welcomes them. And then the supports around young families really matters, be that universal home visitors, be that the doula, community-based doula supports, be that, the home visiting neighbor, the home visiting congregational member, the surrounding of the next generation. After the birth of a baby, families need a lot of support in terms of their well-being, not least of which is their housing, their food, their safety and security, but more importantly, emotional support, reassurance and confidence. All of that in our culture right now, we're really struggling with. So if anything was possible, every one of these blue sky design efforts would create that kind of cocoon of positive support to the future in that first 1,000-day effort.
Yeah, I relate so much to what you're talking about with the hopes and the dreams that a new parent has as they welcome a baby in. And, as a mother myself, I had twins were born when I had a 2-year-old. And so the period after the twins were born, as you can imagine, for the first year or so were really excruciatingly difficult.
Yep.
And I was a person that had, support around me and could have used more support. So yeah, just resonating really with.
And Chelsea, our friend Bruce Perry talks about the recapturing of the complex social networks that have been evolutionarily and historically always present. He would say, out of the research and his awareness, and he says it publicly, that it was 4 adults to 1 baby in supporting relational health and social development. In our culture, it's barely barely 4 babies to 1 adult. Or worse than that, where a baby's isolated and nobody's paying attention, or where some mom is really struggling and she's alone and that baby has relative social neglect. Imagine if, again, your communities come together to say, we're going to do it differently because we're going to embrace this relational connecting effort. We're going to assure the well-being of all of our children and families because the data we know what to do. We've got to organize to do it under the pressures that we're now feeling of that sense of isolation and loneliness.
Yeah, for sure. And I think that's what our design pilots hopefully will be doing in the Upstream initiative, is that looking at what we know to be true already with, the problem that we're facing, and then design what would that first 1,000 days package look like to ensure that the mama or the caregiver has the supports that they need. I want to come back to this idea of what types of supports a new caregiver would have in that first 1,000 days, but I don't want to move too quickly past this idea of the pregnancy. Often I think that that's been largely overlooked. You go to your doctor's appointments, but what does early relational health and these things have to do with the pregnancy?
I'm so glad you're asking me because you're right. I'm so with you there. Maternal well-being, the healthiness of a pregnancy, the beginning of a baby's life, even preconceptually, has to do with the supports and safety and well-being of a mother. And then during the pregnancy period, if one thinks about promoting relational health, it's right back to a pregnancy in isolation without supports, not as strong as we would wish. A pregnant mama needs the support of people around them, loving, supporting the safety, the protection, of course, the social determinants of the food, housing, nutrition, and protection, true, but also a social network. And if she has had any kind of health challenges or has had any kind of, adverse experiences when she's been young, we've been learning that when there's strong, positive, mitigating, authentic relationships around pregnant mamas, you can see the healing of that trauma. The doula network work that we're discovering, the community-based doula movement, is clearly showing that by joining a mom in her narrative and her storytelling towards a positive future beyond what's happened to her to what is possible, shows improved birth outcomes, shows better outcomes for the children, greater birth weight, less prematurity. That's a relational health intervention support by the community that's moving forward. Now, it can be formal, like home visitors, like doulas, but it can also be informal with families and community networks of support. That process has to continue into those first 1,000 days. There's not a break at the birth of a baby. The relationship should carry on. We would hope they'd be more continuous. And again, thinking of both formal and informal support efforts to do so. So it's not a professional per se. It can be, could be, but it can also be the people that are most trusted by the family themselves that they can turn to when they doubt, they can turn to when they're tired, they can turn to when they need support, they can turn to when they have questions. That kind of community building becomes really strong. Now, of course, the health platform, be that an FQHC, Federally Qualified Health Center, Community Health Center, or a pediatric or family practice clinic, those are foundational because they see families multiple times in the first 1,000 days for immunizations, for weight, for well-being. But those efforts have to be supported by community connections, be that a community health worker or a navigator that knows the medical home, or someone the medical home can refer to for supports, mindful of the father and the mother's experience of their own well-being and whether or not they're struggling with any degree of depression or anxiety that needs support. That can be from the community itself, which we know can also countermand those vulnerabilities. We know that builds well-being in children. We see it, we have data for that. The challenge is the intentionality. The challenge is the intentionality. This is universal for all. The cohort of, for the child success model, all babies born, not just those babies, but all of us. That should be a community, cohesive, collective, all-in strategy as an approach.
Yeah, I really appreciate your pointing to the importance of doulas and midwives and just that the importance of that community, the medical provider and the more formal avenues, as well as the more organic tribal quality of, being in community. I remember when I was planning the birth of my twins, I was working with some midwives, and they at one point said to me, "I think that this anxiety you're having about the birth process is probably displaced anxiety about how you're going to take care of 3 babies, when they're born." And that always stuck with me, like, oh yeah, the birth is just one thing, but then there's everything after. But that through line of being able to develop those relationships during the pregnancy, hear that type of wisdom, and then carry it forward. So
Could I add another, Chelsea?
Please.
That is everything that we're learning through our nurture connection work, in our deep conversations with Native communities, Indigenous communities, the Native Alaskan communities, our migrant communities, and those that are really digging deep into how to recapture the strength of our social networking communities. Talks about countering that the future development of a next generation is solely the job of a parent alone. It takes a community. It takes a network of generational supports. It takes an all-in strategy of multiple people. And so many of us get anxious as being a parent alone raising a child. Many parents nowadays have had no experience in any caretaking experience. Whereas 3 generations ago, children were helping to raise multiple children and learn the experiences of being with promoting and connecting and supporting. So recapturing community, multi-generational and multi supports around families is rebuilding the networks and the strengths and the resiliency of communities themselves. And the babies will benefit and their young children will benefit. That counters that isolation. And I would argue mitigates against the vulnerabilities that we're experiencing right now of the mental health epidemic, and then also the media vulnerability, because children are seeking out rather than seeking into the safest connections with themselves.
Yeah, and I love just this idea of intentionality around recreating those community bonds. And that, I think of the social emotional metric that's now being attached to CCOs or coordinated care organizations, but also just how helpful that will be even to our K-12 system as those, networks are restructured. So one final question, we've already kind of started to do it naturally, but that's this idea of like starting to imagine what would that system look like? I mean, that's really what we're holding with this blue sky envisioning process, right? If we were not constrained by the way that the system is designed today, by the way the resources are allocated today, if we could have a system that was designed to ensure every single child that's born has this opportunity to thrive. When you think of what you've heard from families who you've worked with, the data that you've read, that family engagement, from your experience, your expertise, what do you think, what types of supports would need to be in place to foster early relational health in that first 1,000 days?
Early relational health is dependent upon a family feeling safe and secure. So economic supports for a family really matter. And there are communities and counties and cities that are actually operationalizing universal basic income, and they're surrounding it around the next generation of families and babies. Imagine even 2 years of economic support so that that family can have time that where they're not worried about food on the table and they don't have to go running back to work at 6 weeks and a child in poor quality childcare. Part two, got to have a high quality childcare system of supports. Families that are other people that are helping in a community in the care of children need to be adequately paid so that they are likewise not stressed and struggling, but rather can invest themselves in their relational positivity experiences as they help support families in the care of their children in the community safely. That is a network of community-based supports that people can count on, be that family, friend, and neighbor supports, be that in center-based supports, but the quality and the standards have to be really, really clear. The third thing is back to the effort to create that new relational health workforce in a community. Who is it that's going to be the welcome people into a new baby's birth? We do have some formal systems like universal visiting. That's 1 visit to 3 visits in the first 6 weeks. But can we have neighbors that come from the churches or the grandmothers or the neighbors down the street who get a little stipend to touch the lives of the new babies born as their mentor, thinking about, a family or a relational health support workforce whose job is to support the well-being of families as those babies emerge and develop. That doesn't have to be expensive. It doesn't have to be intensive. It doesn't have to be deeply trained. It can be about a promotion effort in that effort. Those efforts make a lot of difference in terms of well-being. We're starting to see the same thing happen in Bridgeport, Connecticut, who has likewise created a baby bundle that has an all-in community strategy with Head Start, early Head Start, home visiting, family education, universal home visiting, parent leadership voices, Reach Out and Read initiative, the medical home community, a whole sequence where a community comes together, imagining child success through a relational health frame. It can be done. It's time. That's a blue sky opportunity in front of us. Then the funders have to come in to support countering childhood poverty and the childcare crisis that we have.
Well, I'm on board. That sounds amazing. I want it for all of Oregon's babies and all of the new parents. I want it for people I love, people I've never met. And so thank you so much for the work you've done in this field and for the work I know you're doing right there in your own home with your own grandchildren.
As nurturing my connection with my cute little granddaughters,
Yeah,
3.5 and age 6 months. It's a joy.
it's so good.
Yeah.
All right. Goodbye. Thank you.
Hey, thanks.